Thank you so much to everyone in the press for joining us today for this press conference. Commissioner Jim Baker is with us. He will be talking about the contract with CoreCivic, which is the out-of-state contract we have to house Vermont inmates in a facility in Mississippi, specifically Tallahatchie County Correctional Facility in Tutwiler. In addition, Commissioner Baker will provide an update on the status of the investigation at Chittenden Regional Correctional Facility. That is another topic that will be discussed today. When the time comes for questions after the commissioner is done presenting, I will call on you in the order that you RSVP'd, and I urge you to unmute yourself at that time. If you have trouble doing so, no worries. We'll revisit you and ask your question. And if we don't have the answer for you at that moment, we will get back to you ASAP. So without further ado, I'm going to turn it over to Commissioner Baker.
Thank you, Rachel. Good afternoon, everyone. Thank you for joining us. We try to do these press updates every once in a while when there's subjects that we think would be of an interest to you and the public from the standpoint of an update. And in light of the fact that today is the first day of the new contract extension with CoreCivic, in our relationship with them at the Tallahatchie Correctional Facility, I thought this would be a timely time to update you all on where we are. The state of Vermont, the Department of Corrections, has extended our contract with CoreCivic for a year with an addendum to that contract. The contract extension and addendum go into effect today. And the addendum to the contract covers the following areas. It increases the price per diem for the full 350 beds that we asked for them to maintain for us. I want to be very clear. We do not intend to have 350 inmates in Mississippi, nor do we pay for all 350 beds. We are budgeted in the current fiscal year 21, for 206 beds. The reason why we have to maintain those other beds is if we have some type of crisis here in Vermont. And I'll touch on that in a few minutes. It clarifies Vermont's inmates must be kept separate from the other population housed at the facility in Mississippi, and that we have control and access over 3 areas, 3 units that contain 120 beds per unit. It also clarifies what direct supervision means, because in the last contract, the language, their interpretation of direct supervision was different than our interpretation of direct supervision. It adds our COVID-19 protocol as part of the permanent contract. We have had an arrangement with CoreCivic where we had sent them our addendum, or excuse me, our protocol, but now it's in the addendum. And that will be updated on a regular basis, and we will provide the protocol update to them on a regular basis. And there's an expectation that CoreCivic will adhere to that part of the agreement around the COVID-19 protocols. As I said, we have increased by 2.8% the per diem per bed. In the last contract, it was $72.99 per day per bed, and this year it is $75.04. Vermont DOC now has direct access to camera systems in Mississippi. We can see those remotely. In fact, our staff today has been monitoring the activity with the Vermont inmates via that camera system. I've already mentioned that there's 120 beds in 3 separate units that we have access to. In an event of an emergency and we need beds available, that's why we're asking for maintaining the option of 350 beds. I want to emphasize that we are not planning on 350 inmates to be out of state in this current fiscal year. In fact, the numbers are going down, and I'll talk about that in just a minute. Why maintain 350 beds? This is an emergency situation for us. I believe it was last winter or the winter before, one of the facilities lost its heating system. And we did not think we were going to be able to get the heating system up. But eventually it got up, but it was getting close to the point where we were going to have to, more than likely, think about moving inmates. And that would have put a lot of pressure on our system. So we maintained that option with a budgeted plan for fiscal year 21 of 206 beds. Let me just touch on the numbers that are in Mississippi right now. We have 211 inmates at the Mississippi facility right now. The general population there has been going down since the beginning of the year. And the reason why we are challenged in bringing individuals back is because of our protocols here. There's a total open bed space of about 97 beds in our system right now, but we have to maintain about 80 of those beds for the purposes of being able to enforce and use our protocol around COVID-19, to include such things as our quarantine protocol, our medical isolation protocol, if we have to apply it. We are planning on this month, tentatively planned for the week of October 19th, returning another 6 to 10 inmates from Mississippi to Vermont, with no other inmates going down. That will bring our population in Mississippi to down around 200. January 1st of this year, we had 268 inmates at Mississippi, and we've been able to reduce them over the last 9 months by 200, from 268 to 211, and by the end of this month, we'll be closer to 200. Due to COVID restrictions in our protocol, we are not able to bring more than 10 inmates back at a time because of the transportation method that is used to return the inmates to Vermont. And the last thing I'll say about the contract with CoreCivic and our relationship with the facility in Mississippi is we are standing up a working group inside corrections to take a look at a plan to end our out-of-state population. We have a 1-year contract, and we're hoping to put a plan in place that can address and completely reduce the out-of-state population. It's going to be a challenge. There is no guarantees, but we're going to be working on that to reduce that population further with the goal of having no out-of-state inmates. So that's the contract with CoreCivic and our relationship with the facility in Mississippi. Let me touch on COVID-19 testing because it ties into the Mississippi facility. This past Monday, the 28th of September, we did the 3rd round of mass testing at the Marble Valley facility in Rutland. All 170 staff and inmates are negative. So we tested all staff, all inmates, and all staff and all inmates are negative. It was the first time that we put Tallahatchie County Correctional Facility in Mississippi in the rotation. We tested 31 of the 32 inmates that were negative from the original test that was done where we had the large number of positive results. 1 inmate refused, and all 31 inmates in Mississippi are negative. Southern State Correctional Facility will be tested on Monday. And then the final facility in our rotation will be done the following Monday, which I believe is the 19th of October, and that's the Chittenden Regional Correctional Facility. And then we will start the process over again, the rotation of doing all the facilities for COVID-19 testing. Let me touch on the Chittenden Regional Correctional Facility investigation. The investigation that began earlier this year has resumed. It was suspended for a period of time due to COVID-19 and the inability for the independent review team to get into the facility. We learned this week that Chittenden County State's Attorney Sarah George has declined to file charges against Corrections Officer Daniel Zorzi. Zorzi was a focal point of the 7 Days article published in December of 2019. The Vermont State Police conducted a full and thorough investigation into the allegations against Officer Zorzi. The Vermont State Police presented that investigation to the Chittenden County State's Attorney's Office, and after review, State's Attorney George has declined prosecution. I am not in a position to answer questions about that decision. Those would have to be directed to State's Attorney Sarah George. The investigation and review of the Chittenden facility by Downs, Racklin, and Martin's law firm and the Moss Consulting Group has picked up within the last 2 weeks is ongoing. And there is still an active human resource investigation into the conduct of Zorzi at the facility, and that will be completed soon. And those are the end of my prepared comments. So I'm going to have Rachel open it up for questions, and I'll try to answer the questions best I can.
Thank you, Commissioner. Okay, we will go down the list in the order of RSVP. So first up to ask a question, we have Lisa of the Associated Press.
Hi, Lisa. Are you there, Lisa?
Can you hear me?
I can hear you, Lisa. How are you?
Okay, good. Hi, Commissioner. So do you have a deadline for when you hope to have no more inmates going out of state?
Not yet, we don't.
Okay.
You know, as I said, it was going to be challenging just because of our bed space, but that working group is standing up and I don't have a deadline for it.
I mean, is this like multi-years down the road or something that might happen in the next couple of years, or can you tell us anything?
I would hope that it's not going to be multiple years. I would hope that we can accomplish this within the next year and a half, 2 years.
Okay. Previous prison contracts, what are the lengths of time have those been? Have they been several years?
Yeah, normally, well, all I can talk to is CoreCivic, but I think the pattern was the same. This was a 3-year contract we had with them, with the opportunity to extend for a year. So that's the normal, you know, somewhere in that ballpark.
Okay. And have all the inmates in Mississippi recovered?
They have. We have no one that is either hospitalized or no one who's in an infirmary right now that was positive.
Okay. All right. Thank you.
Thank you, Lisa.
Thank you, Lisa. Next, we have Eric, Times-Argus, Rutland Herald.
Hi, Eric. How are you?
Good afternoon, Commissioner. How are you?
I'm well, thank you.
So, if this process of getting these inmates back to Vermont takes longer than a year, do you foresee CoreCivic as continuing to be the private provider for this, or would the state look elsewhere?
You know, Eric, I think it's way too early to think about that. I really want the staff to focus in on putting together a plan so we have a little bit better clarity as to what we're looking at for a time frame. But I have no way of commenting or reacting to that at this point.
So you can't say that this might be the last contract.
Can't say that. Look, let me just, Eric, let me say this in response to that question. I don't know anybody, including me, that is involved with our work in the Vermont Department of Corrections that does not want to see us get out of the out-of-state business. So it isn't, it isn't stalling on our part or anybody else's part. It's not as simple as it sounds. You know, we've done a great job of reducing it by the number we have. But the fact of the matter is, if we end up into another bout of COVID-19 and the numbers start to increase, we have to protect our facilities here in Vermont by keeping these beds open for us to be able to manage the space, create quarantining opportunities, and be able to protect people if they do, in fact, get sick as a result of the virus.
I understand. I guess I'm speaking more specifically about this incident with the outbreak at this prison, this company specifically. Would the state want to look elsewhere given what's gone on with this one?
Right. You know, it's just too hard to say right now if we would look somewhere different.
Okay, thank you.
You're welcome, Eric. Thank you.
Thank you, Eric, and thank you, Commissioner. We do have one quick clarification. This is from David Turner, who does work with our out-of-state contractor. So this is a 2-year contract. This extension makes it the 3rd year of the contract.
I should have deferred that question to David because he knows better than I do. So, David, thanks for that clarification. I knew 3 years was in there somewhere, right?
And wasn't trying to correct, just clarify. So we will now move on. Next question comes from Tim at Vermont Business Magazine. Tim, do you have a question for the commissioner?
Good afternoon, Tim.
Thank you, Rachel. Hi, Commissioner. Just to make sure I did my math correctly, this sounds like about $5.6 million for the 1 year.
Yeah, somewhere in that ballpark. We're budgeted for around $6 million, correct?
Okay. And the one question I had about 1 year left, if I were running a prison in Mississippi, I'd be a little nervous about a contract running out in 1 year because obviously it's a big asset to fill. It sounds like they have not given you any kind of deadline as to when to re-up or not then. Is that fair?
What do you mean? Past the 1 year extension that we did with them? Tim, is that what you're asking?
If I were them, I'd want to, frankly, a longer commitment from Vermont because I have this huge asset I'm sitting on. But they haven't said anything like that.
No, not at all. You know, I communicate with the CEO of CoreCivic on a regular basis, and I mean, I think we have an understanding about our business relationship, and they understand that you know, a lot of states are in the same position we are as far as out of state, and they understand where we are. They've been very cooperative.
Okay, great. Thank you.
You're welcome, Tim.
Next up, we have Jim from the Valley News.
Hi, Jim. How are you? Are you there, Jim?
Yeah, Commissioner, can you hear me now?
I can hear you, Jim.
You can't hear me?
I can hear you. How are you?
Good. Sorry. With the during the COVID lockdown in Tallahatchie, inmates were unable to do their prison jobs, so they lost wages. Is there any plan, or maybe it's already in place, to reimburse those inmates for those lost wages? Because, as you know, that's money is important for them for phone calls, for food. Can you give me an update on that?
I do not know that. Dave Turner, are you there?
Yes, sir.
Do you have any information on that, or we can always get back to Jim if we need to?
Well, the former warden reached out to us at the end of the month of August when pay is due. They pay them once a month, and asked what we wanted to do with pay. And we told them to make the inmates whole if they are not working due to the virus, and only due to the virus, then they should receive their full amount of pay. And we've told the current warden he should do the same for September.
Thank you, David. Jim, does that answer your question?
Yes, that's just what I was looking for. Thank you, sir.
You're welcome. Thank you.
Okay, next up, we have Greg from the County Courier.
Hi, Greg. You there, Greg?
Okay, we can come back to you, Greg. Next, we have Dom from WCAX.
Hey, Dom, how are you?
Hello, can you hear me?
I can, Dom. How are you?
Pretty good. Just wondering what the possibility is, or if there's been any more discussions on building a new prison in Vermont. I know it's an idea that's gone back and forth. The governor has expressed some interest in it in the past. I wasn't sure if that's part of this future discussion.
It will be part of the future discussion about how we manage the population. As you may or may not be aware, there was money in the capital budget in the last round of capital funds for us to do a feasibility study. And that contract, I believe, was just recently awarded to a contractor to take a look at feasibility. So that will be part of the conversation, and that will play into the conversation of the working group around continuing to reduce the population in Mississippi.
Do you think, just a quick follow-up, do you think that's a large possibility, or do you think it's just one of the many options on the table?
Well, look, I can't predict what will go into a capital budget for the next biennium, which will happen in January. And I certainly can't predict where the legislature will go with it. I do know that we're supportive of exploring the idea of replacing the women's facility, at least. I know the governor is supportive of that as well.
Thank you.
You're welcome. Thank you.
Thank you. Quick, going back to Greg from the County Courier. Greg, are you with us? We'll return to that. Next up, Colin from 7 Days.
Hey, Colin, how are you?
Hey, good. How are you?
Well, thank you.
Good. Thanks for having us. So I was just curious, have you had a chance to personally review the VSP report into Daniel Zorsi?
I have.
You have? Okay. Is there anything you can say about the findings of that report? Do you agree with Sarah George's decision?
I'm not the prosecutor. I read the report. I want to acknowledge the fact that the Vermont State Police put a great deal of effort into it. And I do not want to comment on what State's Attorney George's thought process was. But in reading the report, I believe that she got to the right conclusion.
Okay. And two other things. Is the report something that, do you know if that's going to be made public at any point? Is your
it's not, right? It's not my report. It's the state police report. That would have to be up to the state police to determine that.
Okay. Would you support that though? I mean, do you think that people should read the report or see it?
Well, look, Colin, it's kind of a tough position to be in because I certainly wouldn't want Commissioner Sherling commenting on releasing something that was property of the Department of Corrections when it comes to the report. I don't want to be speaking on behalf of Commissioner Sherling at Public Safety.
Sure. Okay. And lastly, you had mentioned that an administrative review is still going on. Can you speak any more about that? Is Mr. Zorsi still on paid leave, or what's his status, and what's the status of that review? Is there any indication of how long it's going to take?
Mr. Zorsi is out on leave, and the review being done by Downs, Racklin, and Martin, I think is well underway. I haven't talked to them about what they think the renewed date of finishing their work is, but I do expect that the Internal Affairs Human Resource investigation will be completed and reviewed within the next 30 days.
Next 30 days?
Next 30 days. I'm
Okay.
not talking about Downs, Racklin, and Martin, Colin. I'm talking about the internal HR investigation.
Sure. And to clarify, he's on paid leave, right?
There is an arrangement with the union where he's no longer on paid leave, but he's on leave.
Gotcha. Thank you.
You're welcome.
Next, we have John from VPR.
Hi, John.
Hello. Thanks for holding this. Just another question related to the Chittenden facility. Obviously, as I'm sure you know, charges, criminal prosecution is just one way of changing things and dealing with a situation, and perhaps sort of the cultural change are changes that are needed or outside of the criminal realm. Do you think things are changing? The cultural issues are being addressed that were, you know, the underlying issues that were raised in the 7 days piece about the sort of how inmates were treated, the power plays on the part of the staff there. Are those being addressed to your satisfaction?
Let me start out by saying, John, that 9 months into this, I'm coming to understand just how complicated the correctional system is, and I'm coming to understand just how difficult it is to work in the conditions of mandatory overtime and so on. And I'm kind of laying the framework to answer your question here. I have openly talked about the challenges around culture inside corrections. What I will say to you is that are the cultural issues, because the cultural issues are not just focused on Chittenden, they're focused throughout the system. And there's a lot of reasons for it, and there's a lot of causes for it. And what I will say to you is that as the commissioner, I have a pretty good understanding now from a lot of conversations with staff, supervisors, superintendents, leadership in the central office. I have a pretty good idea now what's the underlying issues around the culture. And as I often say to staff, understanding it and do something about it and changing culture is a different thing. So to answer your question, I think the underlying issues are identified. We're waiting for the focus groups from Moss to affirm what we think we know. And we have ideas on how to move forward to change that culture. But I will say this, is that what I get for feedback from longtime correctional employees is that they feel like the conversation has finally opened up and there's been an acknowledgement about what some of these issues are. And the first thing you need to do is acknowledge your issues before you can fix them.
Right. So will there be, you mentioned these reports, will there be, with the reports, a plan, sort of an action plan to take to implement changes that are necessary based on what you've seen and identified with the culture?
We are, yeah. The short answer would be yes. But we've already started that process. Besides, the Moss Group is a pretty well-known consulting firm within the correctional world, not only in the United States, but internationally. And besides the work they're doing with Downs, Racklin, and Martin, we've also engaged them to help us work on a new mission, vision, and value statement and code of conduct. And so that work is already started. And, we're taking a look at our hiring process. We're in the process of changing that. And I think that has a big part in the cultural issues that we face in the field. And I gotta say, I started out, John, by saying this, and I never want to miss an opportunity to say this. Even though what was reported in 7 days and still stands as public information, in my 9 months that I've been at corrections, the vast majority of the correctional officers, probation and parole officers, and support staff and leadership that works around me are incredible human beings that work very hard every day to provide the safety and security to those folks that we supervise. That's the vast majority of the employees I've met. And so I have to say that because sometimes corrections gets painted as this agency that everyone looks like what was documented in the story in 7 days.
Thank you.
Thank you, John.
Thank you. Next, we have Alan from VT Digger.
Hi, Alan Keyes. Alan, are you there?
Alan, I see you're here. You're still muted, it looks like. Okay, we will come back to Alan. Next, we have Ross from WPTZ.
Hello, Commissioner. Can you hear me?
I can. How are you?
I'm well. How are you doing?
Good talking to you, Ross. Go ahead.
Good. So going back to the addendum briefly, you mentioned that some of the language in it clarifies some of corrections, roles and duties, and kind of maybe the influence and the say that you get with how things are done there. I know I'm paraphrasing you there. Can you clarify what those instances are, what some of the specifics are as to what's been clarified and things that you maybe will have some more clarity to have a say in that were somewhat disputed before?
Yeah, I mean, there's a couple. I mean, we all know what happened with the outbreak a month and a half ago, and it was a serious outbreak, and I was pretty upfront about my concerns as a result of that. The fact that we have made it clear in the contract that the expectation is that they follow our protocol on COVID-19 is a big step towards us keeping the inmate population in Mississippi safe. So that's a big part of it. And our ability to be able to get access via the camera system to see what goes on every day is a big part of us keeping that inmate population safe. But one of the bigger ones is, I touched on this very quickly, talked about direct supervision. Prior to this, their version of direct supervision was different than ours. So for example, for us here in Vermont, when we talk about direct supervision, we mean that if inmates in a unit are not in their cells and they're out in the common area, that there's staff there with direct supervision of them. That wasn't the same language that was understood by Core Civic. So that's an example of where we cleared up an understanding that we believe will keep our inmate population in Mississippi safe and make sure there's order in the units at Mississippi. So that's just a couple examples of clarifying what we expect in our relationship with Core Civic.
Understood. And I know you said that there are no inmates currently in an infirmary or in the hospital down there in Core Civic, but are there any active positive cases of COVID-19 among the Vermont population?
No, there is not.
Okay. Thank you very much.
Thank you, Ross. Next, we have Alex from the Journal Opinion.
Good afternoon, Commissioner.
Good afternoon, Alex, correct?
Correct.
How are you?
Could you tell me whether any New Hampshire or other border state facilities were considered for out-of-state placements? And if so, what maybe some of the barriers are to those locations hosting Vermont inmates in the future?
We did, in fact, look around New England for other opportunities. The sheer number of folks that we have was a challenge. And the other challenge is our high expectation of medical care is a barrier in a lot of situations. For example, maybe a county jail would have 100 beds or so free, looking to place, look for population to fill those beds for revenue. In most of those cases, if not all of them, they don't have the 24-hour nursing coverage and medical coverage that we require. And then we did look at a couple options, but then we would have to break the population up in multiple locations. And it's and they weren't all in the same area. So now you're keeping track of out-of-state population in multiple areas, if that makes sense.
Okay, thank you very much.
Welcome.
Thank you, Alex. If we have other people on the line, we'll call for that in a second, but I want to return to the two people that we did not hear from. Greg from the County Courier, are you on the line? How about Alan Keyes, BT Digger? Are you on the line? Do you have a question?
Yes. Commissioner, will the...
Hi, Alan Key.
Hi,
Alan
Commissioner.
Keyes. How are you?
Good. How are you doing?
Well.
Will the inmates in Mississippi have access to the MAT program?
David, are you there? I don't know the timing of this, Alan. That's why I'm hesitating for a minute. David, are you there?
Yes, sir.
Can you take that question, please?
The MAT program is not part of the contract extension. However, all inmates in Tallahatchie have an opportunity to request MAT, and they get evaluated by the staff here in state on a cursory medical review of their medical file. And if they're determined somebody that may have an opiate use disorder, they are placed on the next transport back to Vermont to be further evaluated and possibly placed on MAT.
Does that answer your question, Alan?
Well, did the Department of Corrections try and make that part of the renewal contract? And did CoreCivic refuse to provide that service?
No, we didn't. We didn't ask for that service that I know of. And I, as the commissioner, managing our medical and our medical assisted treatment program is significant and it's challenging. So having that in state is a better model for us than making sure that people are living up to the program and what our expectations of the program are. So we were not looking for that in Mississippi.
Thank you.
You're welcome.
Thank you. Okay, at this point, is there anyone on the call that is from the media that I did not call on who has a question for Commissioner Baker? If so, please unmute yourself and announce who you are and ask your question. Okay. Hearing none,
Right.
I think that brings us to the end of our press conference.
I
Commissioner,
want to thank everybody. Yeah, I want to thank everybody for joining us. We try to do these every so often when we have information to share. We'll continue to do this in the future. We appreciate the fact that you take the time to come and listen to what we have as updates to the Department of Corrections, and thank you for your time.
Thank you.
thank you, sir, and thank you all. This video will be posted on our website.
Just stay on for a minute, Rachel.